We're going to go a little bit over the passive drowning victim. Most of our interactive videos are basically distress swimmers and drowning victims. So, the passive drowning victim is basically the person that is now submerged underwater. They're not trying to do anything, they're not flailing, they're not trying to keep their head above the water, they're not trying to do any real motion. Sometimes they'll just appear that they're hanging in the water. So one of the big things about passive drowning victims that cause it. So one of the ones is the first one is like seizures. Somebody could come to your pool with a medical condition that has seizures, has a seizure in the water, and they will just go stiff. And sometimes they'll appear to be shaking. And we'll talk about that in a second. They could have a cardiac arrest. Quick note about that: Calgary had a cardiac arrest on their swim team. They actually had one of their swimmers who were training for the Olympic team ended up having a cardiac arrest. And lucky the lifeguards were on cue because a lot of times we feel that lifeguarding a like Olympic level swimmers will never really going to have a problem. And this young lady actually had a cardiac arrest, and they were able to pull her out and resuscitate her. A person could have a stroke. There's lots of diabetics. Diabetics can range from zero age, right, all the way up to if you have that patron that comes that's 99 years old. Hyperventilation happens too. You get these people that want to hyperventilate. They do that hyperventilation, then they do the breath holding, which is the next line there, and they do the breath holding underwater. And eventually, with that hyperventilation and breath holding, they'll just pass out. Other thing that happens is drugs and alcohol. Big opiate crisis right now going on. So if you had somebody come into your pool and decide to use some type of opiate or pretty much any other drug, an overdose on it, and then they got into the water, they could easily slip under the water without you noticing. And another big one is just trauma, right? So diving to shallow end, jumping kitty corner from corner to corner, and striking your head, and eventually knocking yourself unconscious. So some presentations that we got to look for. So floating face down on the surface of the water, or just below. Sometimes floating upright. Sometimes that position, you look at that guy and go, "Oh, he's just breath holding. He's going to be okay." Um, Quick story about people just holding breaths. I was out at Allen Beach one time training for a triathlon, and this poor guy gets pulled out of the water by two other gentlemen. It turns out they were sitting on the dock and they could see this guy floating underwater. And all the conversation was, this guy can really hold his breath for a long time. Which luckily these two guys were smart enough to think that it's been a long time. This guy should be coming for air. They actually went and pulled him out and brought him to shore. And there was enough people there, like being a paramedic. There was a nurse. There was a RT there. It was amazing the number of people. And then the ambulance showed up, and the patient or patron, actually, the guy that was swimming out there that was underwater, actually was resuscitated. So if you see somebody underneath the water, and it's why we get twitchy about lifeguards as lifeguards, is when we see people doing this breath holding, like, oh, who can hold their breath the longest under the water? So anytime that we see that kind of position, we should actually go take a look if they're okay. Another one too is that they'll appear unresponsive. Like in that past picture, they may not be moving, but because of the water, they may bend their body in different ways. They may shake a bit. If they're shaking, that doesn't mean they're trying to swim. It probably means they're actually having a seizure of some sort and need immediate attention. Another thing they do as a passive drowning victim is sometimes the passive drowning victim is just so scared, or they go into the state where they don't do anything, so they appear to be hanging in place. So if they're just kind of got this vision of hanging in the water and they're not struggling to help themselves, that might mean they're actually a passive drowning victim. And then again, we have this kid here, like when we were talking before. Either way, that being a active drowning victim, whether you're passive drowning victim, if you're in this position for a long period of time and you have no obvious forward locomotion, or he's not trying to do anything, like I said, his legs were moving a little bit, I'd definitely be going in to get this kid. The other thing we're talking about, if you see anybody lying on the bottom of the pool, whether they're lying on their front or their back, you need to go and investigate it. So basically, if somebody's got their head on the water, we need to start checking on what's going on, because most people regularly come up to get a breath of air.